Hello. Testosterone changes things downstairs in ways that matter for how you take care of yourself. When you're on testosterone, the vaginal tissue becomes thinner, drier, and more delicate. The pH changes, the normal bacterial balance shifts, and the estrogen supported environment that help maintain those tissues changes significantly. I'm Dr. Dave, your transgender health and hormone specialist, and I've got 30 years in the field. Let's talk about it. A question I get surprisingly often is if I'm on testosterone, how am I supposed to clean downstairs if it stops self cleaning? The first thing you need to know is that you do not need to douche. For most people, plain warm water on the outside is genuinely enough. The external anatomy, the vulva, only needs gentle washing like any other skin. No harsh soaps, no scented products, and nothing needs to be routinely cleaned internally. Now, testosterone can cause vaginal atrophy, and that means dryness, possibility of irritation, increased tissue fragility, discomfort with penetration, spotting, burning, or changes in discharge. Those symptoms are common, unfortunately, but they are not something you simply have to live with. If you're noticing odor, unusual discharge, irritation, pain, bleeding, or something that just feels off, don't assume you just need to wash more aggressively. One of the most common causes is bacterial vaginosis, which we see quite frequently in trans men on testosterone, but there are often other possible causes that need proper evaluation and treatment. That's a conversation for you and your clinician, not a reason to reach for a commercial douche product. And if the urge to cleanse is coming from dysphoria, I want to acknowledge that too. It's very real. I know for some people it isn't really about hygiene. It's about discomfort with a body part that just doesn't feel like it belongs. And that is a real sensation and feeling. But washing more doesn't usually solve the problem. In fact, it usually makes the physical sensation and symptoms worse. The good news is that treatments such as topical vaginal estrogen can improve dramatically atrophy symptoms without affecting masculinization. Bottom line, warm water outside, no routine douching. Talk to your provider if something seems wrong. And remember, discomfort, dryness, irritation, odor changes are common on testosterone, but they're also treatable. You deserve care that addresses what actually is happening, not just advice to ignore it. What questions do you have about testosterone and body changes that nobody has ever answered for you? Drop them below. I always read them and I always try and answer all the questions as quickly as I can. Thank you for your support as always. And if you made it all the way to the end with me, you know the deal. Leave me a meow or a cat emoji or even a picture of your cat in the comments. Meow, meow. Let's remember to support, love, of course, support and protect each other. Thank you.